After Premier Doug Ford issued his entreaty over the weekend urging Ontarians to please go get a test for COVID-19, more and more people are flocking to assessment centres like this one. But there's growing concern on the part of immune-compromised patients that this new policy puts them at increased risk of exposure to the virus. One cancer patient was shocked and angry when she was told she had to line up here at Mount Sinai with more than a dozen other people, some of whom were showing symptoms.
It's ridiculous. I am gobsmacked.
Kara Heitman was diagnosed with breast cancer in February. After a delay, she finally had a mastectomy 5 weeks ago, but the cancer had spread. Recently, it was detected in her lymph nodes, and she's scheduled to start chemotherapy tomorrow. Her oncologist from Mount Sinai told her she had to be tested for coronavirus before starting the drug treatment and to go to the hospital's assessment center, something she strenuously did not want to do.
I asked if I could be tested somewhere other than a COVID testing center. I was told no. I asked if I could go to a different hospital that had a drive-through COVID testing center. I was told no. To me, that's unacceptable. Now I have the doctors sending me into the belly of the beast to be tested for COVID. It makes no sense. You are putting me at risk.
But Kara felt she had no options and went this morning. And while she was allowed to wait outside, eventually she had to navigate a long, narrow hallway with other people waiting in line.
As I was doing the intake, the gentleman six feet to my left told him that he is exhibiting COVID symptoms. He phoned his doctor. His doctor told him to go get tested. I should not be sitting 6 feet away from that gentleman.
Ontario's top doctor agrees.
Is it reasonable that she should have to line up with the general population, some of whom were showing symptoms?
I think the point you raise is a good one, where their physician who is organizing the surgery and is asking for that would want to have good advice given to their patient of where they could obtain the test in a safe way and with a proper protocol, with a booked appointment perhaps in a timing rather than waiting in a long lineup if there is one.
Kara tells me she did not have time to make an appointment. She was informed Friday that a test was needed, so she had to go today. But she feels strongly that it only makes sense that there be a separate testing space for cancer patients in order to minimize exposure as much as possible. As she says, if someone like her catches COVID-19, it could possibly be a death sentence.
If you don't have an immune system, that's what happens.
We reached out to Mount Sinai for a response. They said in a statement that a separate testing area is not necessary. The safety precautions they have in place are enough, such as providing hand sanitizers and masks, ensuring physical distancing, and disinfecting assessment bays. However, Sunnybrook Hospital tells City News that they do take steps to separate cancer patients. They provide COVID-19 testing for them before the assessment center opens to the public. I'm Pam Seatle, City News.